Turning now to the coronavirus pandemic. Right now, the majority of hospitals report they need immediate backup to handle the surge of COVID patients. Facilities are on the brink of a critical staffing shortage. That's according to the Florida Hospital Association.
8 on your side found there is a possible solution to alleviate the staffing issue, but as investigator Masa Saidi explains tonight, it will take some action from the governor.
That's right, Keith and Stacy. The governor could suspend state law and allow out-of-state nurses to work in Florida. Our nurses would welcome the help. More than a year and a half into this pandemic, they are physically and emotionally exhausted. Facing the fourth wave, healthcare workers, including Lakeland nurse Tiffany McMahon, are wiped out.
It's just a vicious cycle of not having enough nurses and then them quitting because they're exhausted.
Staffing is our #1 need right now.
At a news conference on the Delta variant, leaders from 3 of the largest hospital systems all told us, and Bay Area facilities, the volume of COVID patients is unprecedented.
We need clinical nurses, respiratory therapists.
While there's a clear consensus that hospitals are overwhelmed, there's little agreement on how to fix that staffing crisis or who should be doing it. Governor Ron DeSantis has said that hospitals have it under control. But Representative Kathy Castor, a Democrat, says he needs to take action now.
I'm asking the governor to issue an emergency order so that we can unlock additional staff. I'm scared for this community.
I spoke with folks in Central Florida and beyond. They all say that this is their responsibility, and I know that they're making whatever arrangements they need to do.
Are hospitals equipped to handle this surge? I contacted facilities and healthcare professionals statewide. I learned what they need are more nurses, a lot more. Last year, via executive order, Florida allowed hospitals to bring from out of state any licensed healthcare worker to help. But that's all changed. Now, during the most critical time of need, nurses with out of state licenses can't work here. The executive order expired.
Well, good afternoon.
In recent days, Governor DeSantis has urged Floridians to seek monoclonal antibodies to treat COVID. There are more than a dozen sites that offer this potentially life-saving treatment for free.
Getting it early is important.
During a news conference in Hudson, Governor DeSantis said Regeneron will help keep people out of the hospital, thereby reducing the surge. We asked if there was more that he could do. Given the situation with the hospitals right now, would you consider suspending state law to allow nurses with an out-of-state license to come into Florida and to immediately be able to help?
Well, I think that they should be able to do that. I mean, I'd have to look to see, we've obviously supported that in the past.
And the governor said that hospitals are not specifically asking him for more staff right now. But as you heard, he thinks that it does make sense to waive that licensing requirement. Meantime, the Florida Department of Health tells me in general it is expediting licenses to help support hospitals. And the department has also launched a new system to connect new license holders with potential employers, trying to make it easy that way too.
Masa, what about getting nurses from the feds or from FEMA? I know other lawmakers have mentioned that.
That's right. Now, this shortage is a nationwide problem. As I understand it, there's no pool of nurses just hanging out somewhere. In fact, just this month, FEMA sent out an alert outlining what states, communities, and hospitals should do before asking for backup nurses. Due to the nationwide surge of COVID cases that we have seen, there's just not a lot of federal staff available right now. But if the governor does waive this requirement, hospitals can get staff from sister facilities that are not experiencing a surge.
Thank you, Masa.